Meningitis is a potentially deadly disease that affects more than 1 million people worldwide each year. World Meningitis Day was celebrated on the 24th of April. And the theme for 2017 is 24 hours, trust your instincts. Now, 24 hours can mean the difference between life and death for anyone at any age afflicted by this disease. The focus this year is on alerting families about how quickly meningitis can spread. So today we focus our discussion on all important aspects of meningitis. And assisting me in this is a guest panel comprised of an adult and a pediatric clinical microbiologist, both from the National Institute of Communicable Diseases, or simply NICD, and the retired head of the Department of Pediatrics and Child Health at the University of Witwatersrand. Now, please be part of this show by asking the panel some few questions or simply just sharing your views with us. In that case, the number to call is 011-714-6918-6919. You can also tweet us at SABC Health Talk or simply just interact with us on our Facebook page, SABC Health Talk. Sit back, relax, and learn from this exciting show coming to you just after a short break. I'm Dr. Solomon Daung, and this is Health Talk.
Well, a very good morning and welcome to AM News Live at 1000 hours across all Central African regions.
A fitting send-off for a revolutionary giant, a life dedicated in service of the people.
The result means that the Swallows are out of the ABC Multiple League and drop to the amateur fourth tier of South African football, the SAB League.
Tune in on AM News every Saturday and Sunday from 10 hours.
After a horrific accident, major questions were asked.
So step one, I asked myself, do I really want to die? And my answer to that was, I'm not sure. And then step two was, do I want my parents to bury me? And the answer to that was no.
Learning kept his brain in full action on how the brain works.
When I was in hospital, right, as I was saying, to catch up with my peers, I started to become obsessed with memory techniques and how the brain works and how we retain information.
Touching lives is his continuous mission.
I now work for a non-profit where we deal with access issues regarding kids with disabilities and persons with disability. We're busy working on beach access.
Being wheelchair-bound did not stop fun in his life.
I party in a wheelchair. I laugh in a wheelchair, smile in a wheelchair.
For all your uplifting stories, catch Bupilong every Friday.
My daughter Charlotte had meningococcal septicemia in December 2010. Charlotte was nearly 3. My mum and my sister had looked after her that day. Absolutely fine, normal, nothing untoward. About 10 o'clock, she woke up and was very, very sick, but very quickly and just settled straight back to sleep. So I just assumed that it was just one of the sickness bugs going around. I just kept an eye on her. I gave her some Calpol, and it just appeared that she was asleep. My coat, my bag, ready to go to work, and I just checked her, and she just had 3 really small purple sort of spots on her chest. And I immediately ran and got a glass. I rolled it over the spots, they didn't fade. And then by that point, because I thought, I just was alarmed then, and I called an ambulance. The patrol car came and he checked Charlotte's vital signs and obviously then called for the backup ambulance. The ambulance lady, you know, said, hold Charlotte in your arms. And I think that was because she just didn't actually know if Charlotte was going to make it or not. And then by the time we got to the hospital, those 3 pinpricks had turned, you know, into like a rash all over her body. And I saw the illness take over, like her eyes turned a funny colour. They went from white to like yellow. And I just saw everything take over. The staff was waiting at the John Ratcliffe, and it was just from there, it was like a real emergency fight, you know, for Charlotte's life.
All right, so that's the condition called meningitis. Now let's learn more about this condition. And I have 3 special guests who are going to help us go through this. First up, closest to me, is Professor Nilesh Govender, who's a clinical microbiologist from the National Institute for Communicable Diseases, or NICD. And next to Prof. Govender is Prof. Anne van Gotbeck, who's also a clinical microbiologist, also from the NICD. Now, the NICD, of course, as you know, is an agency of the National Department of Health, and therefore both of them are here also representing, if you like, the National Department of Health. Welcome to Health Talk.
Thank you.
Right. And of course, we have Professor Peter Cooper. Prof. Cooper is the retired academic and clinical head of the Department of Pediatrics and Child Health at Wits University. Welcome to Health Talk once again, Prof.
Thank you very much.
Right. Perhaps let's start from the basics. We're talking meningitis. I'm sure a lot of people there know what meningitis is, but you know, for the sake of others and for, again, clarity, what is meningitis?
Well, it's an infection of the lining of the brain and the spinal cord. And it's caused by a variety of bacteria, but we do sometimes get viral meningitis and TB meningitis. So it's a whole spectrum of disease depending on the organism that's causing it.
All right, okay. So I'd imagine there's different types of meningitis. You know, when I introduced both of you, I said one is an adult microbiologist and the other one is a pediatric microbiologist. Perhaps, Prof. Anne, if I could start with you, from a kid's perspective, what types of meningitis do we see?
So, for example, the story that we heard about that child who was admitted with a rash, that's an acute bacterial meningitis, and specifically it's meningococcal meningitis, which is one of the more rapid meningitis that tragically cause death in very healthy infants unexpectedly. And I think that's often the meningitis that we hear about in the media. But the other causes of acute bacterial meningitis, pneumococcal, Haemophilus influenzae, and the viral meningitis or meningoencephalitis also occurs in children. And I think one important thing to think of in pediatrics or in child health is that there are vaccines that can prevent these meningitis. Very
good point. We are going to be talking about prevention just and the importance of the vaccine. Very good point. Prof. Govender, in an adult perspective, I mean, we hear there's all other different types of meningitis. We've heard of the bacterial meningitis. What about other causes like viral, fungus, and so on?
Absolutely, Selo. So HIV-infected adults are at risk for bacterial meningitis, for TB meningitis, and also fungal meningitis. So one mustn't forget that group of patients, because the burden of disease is very, very large. In South Africa, thousands of patients are diagnosed, adult patients are diagnosed each year.
Do we actually know the actual figures? I mean, what's the prevalence or incidence of this condition?
So in terms of fungal meningitis, we've recently done some work looking at the global burden of cryptococcal meningitis, which is caused by a fungus, and approximately 200,000 cases a year, about 150,000 cases in sub-Saharan Africa. And in South Africa alone, between 7,000 and 10,000 cases of cryptococcal meningitis are diagnosed each year.
What about children? How common is meningitis in children in South Africa?
Well, it is common in the sense that because it's such a severe disease, there's death, and people are very worried about trying to prevent or trying to make sure that children don't get sick. We have over time and different seasons and in different age groups, about a few hundred cases in 1 year, for example, in South Africa, of, for example, meningococcal meningitis. Other causes of pneumococcal we're also counting, so we are doing surveillance. We don't know all the cases in our surveillance, but we're monitoring those that we can detect, that are diagnosed in a laboratory, or doctors make the diagnosis. We do monitor those, and we get a good idea of what's been happening over the years.
Okay.
And interestingly, with the vaccine that was introduced, there's been a massive reduction in 2 or 3 of the bacterial and viral meningitis causes in South Africa, and we've been able to show that.
All right. Prof. Cooper, I'm sure people watching this program would then ask themselves, oh, how will I know that my child has meningitis? Are there typical signs and symptoms?
Well, it depends on, excuse me, it depends on the age of the child. The classical presentation in an adult and an older child is with fever, headache, and they have what we call photophobia, which means that they avoid bright lights because that's painful. And then when we examine them, they have neck stiffness and other signs that we would look for. But in younger children, particularly below the age of 2, these signs, well, firstly, they often can't tell you that they've got a headache and don't like bright lights. But secondly, even the classical signs are often absent. So the younger the child, the less likely those signs are likely to be there. And so in the younger child, particularly under the age of 2, under the age of 1, and in the newborn, we have, if they're presenting with what seems like a serious infectious illness, we would often do the diagnostic test, which is a lumbar puncture. And what that involves is putting a needle into the spine, into the back, to take out what we call cerebrospinal fluid. That's the fluid that's surrounding the brain and the spinal cord. And then we send that off to the laboratory, and they can do the tests that will tell us whether there's meningitis or not.
Okay.
So parents are often worried that we want to do a lumbar puncture, but it's very important that we do when there's suspicion. Otherwise, the disease will progress and will become much more serious.
Right. There was reference earlier to development of a rash as a possible sign that there might be meningitis. Let me just put it crudely like that there might be meningitis.
Well,
do you want to comment on that?
In fact, that's one of the misconceptions. So meningococcal meningitis, not all of meningococcal disease, and the description of the disease was more the sepsis of meningococcus.
Right.
So not all meningococcal disease is meningitis, and not all sepsis is meningococcal disease. And so that rash is one of meningococcal sepsis.
Right.
And I think that's what I think they're doing with the meningitis days, trying to tell parents, just as that mother, trust your instincts. Know about this disease, about meningococcal sepsis overall, not just meningitis, because that's the one that worries us so much and causes death so suddenly. And when you see that rash, or when you see signs and symptoms that have been mentioned, that go to a doctor, go to a nurse, go back. Even if they said, no, we're not so sure, go back again. And trusting your instincts will be able to get that child to treatment as quickly as possible.
Prof. Governor, any typical signs and symptoms in an adult?
So, I mean, certainly adults need to know their HIV status, because most cryptococcal meningitis occurs amongst HIV-infected adults. And so the signs and symptoms are very similar to those described in children, but the distinct feature in cryptococcal meningitis is that there's a severe progressive headache that gradually becomes worse and worse and worse and becomes intolerable. And may be associated with loss of consciousness eventually, and requiring obviously urgent hospital-based treatment.
Yeah. All right. Well, time for a quick commercial break. When we come back, we're going to try and answer the question now, how do people get infected by meningitis? That after the break. Please stay with us.
typhoid outbreak that broke out in Zimbabwe's capital late last year has claimed the life of a 13-year-old girl in Harare's township of Mbare.
Most residents have put the blame on the Zimbabwean government for the debilitating economic situation.
There is no interest in the affairs of the city and the town, and really we have to do something about it.
One expert believes the Barclays ABSA apartheid funding saga reeks of political factionalism. Yanni Rousseau
says things are not as they seem.
And the money, well, that was whisked out of the country.
ABSA paid full value for the assistance. So from that perspective, I cannot see how it can be made out that ABSA benefited.
Welcome back. Before we continue our discussion on meningitis, let's take Emmy on the line from Joburg. Emmy, welcome to Health Talk.
Thank you. Hello. Good morning. Good morning, doctors.
Good morning.
I want to know, as a layperson, of course, virus and bacterial. The one, is it infectious to another person? Bacterial, do you pick it up? I mean, I don't know how it works. And if I find a rash, for instance, on my child, how would I know it's chickenpox and it's not meningitis?
Okay, excellent questions. Amy, we're going to show some small clip, and when we come back, we're going to, get the experts to respond to your questions, all right? All right, now, folks, 23 states in Nigeria are currently battling an outbreak of meningitis, with 8,054 suspected cases so far confirmed by the Nigerian Center for Disease Control. Now, one of the keys to curing meningitis is prompt treatment to save lives, and this you're going to hear more about shortly. Take a look at this.
An outbreak of meningitis has hit Nigeria. According to the Nigeria Center for Disease Control, meningitis has killed as many as 745 people in previous weeks. It's not the first time Africa's most overcrowded country has been affected by such an outbreak. More than 2,000 people in Nigeria died from the disease in 2009. Aid agencies such as MSF, also known as Doctors Without Borders, are doing all they can to stop people from catching the disease. James Kambaki, who's a nurse by profession and has worked on the field across sub-Saharan Africa, explains to us the work that MSF does when there are such outbreaks.
One of our biggest principles, we say, is to save lives and elevate suffering in that particular situation. So we're looking at really saving lives as quick as possible. So we set up hospitals, or we support the Ministry of Health facility that deals with that. So sending in personnel, doctors, nurses, to actually help taking care of those patients, saving the lives of those patients, using the drugs that we are going to also support and provide.
According to the World Health Organization, even when the disease is diagnosed early and adequate treatment begins, 5 to 10% of patients die typically within 24 to 48 hours of the onset symptoms. James explains why.
I think it's also in that context, the meningitis belt from Western Africa to East Africa is very difficult terrain in terms of logistics, in terms of organizing diagnostics, in terms of actually before confirmation is made, possibly several patients have actually died because it's difficult to reach those places.
Doctors Without Borders is a humanitarian organization that looks to help people worldwide where the need is greatest, delivering emergency medical aid to people affected by disasters or exclusion from healthcare.
In Southern Africa, we're lucky that we're not in that meningitis belt where these outbreaks. So what South Africans could do is to contribute to these organizations that help out, like Doctors Without Borders, not only in funding but also in personnel. So we'd like more doctors to come work with us and support us in meningitis vaccination and meningitis case management, nurses as well, to come forward and support during this time.
Meningitis occurs throughout the world, but the majority of infections and deaths are in Africa, particularly across the meningitis belt. This disease is potentially fatal and should always be viewed as a medical emergency.
A potentially fatal disease. And now we're going to hear more about this. I still have my three guests, Prof. Nilesh Govender, Prof. Anne van Godbeck, and Prof. Peter Cooper. Now, earlier on, we had a caller that asked a question around, how the disease is transmitted. And this is quite relevant because we've just shown a clip of the outbreak and also about, the rash. Perhaps let's just, before we start our discussion, let's respond to Amy's questions.
So specifically, she asked about viral meningitis versus bacterial meningitis.
Right.
And to answer her question, both of them are germs and both of them are transmitted from person to person.
Right.
Different bacteria and different viruses have some differences in how they are transmitted, but generally one can say that for the bacteria, for most of the bacteria, it'll be respiratory, and so it's coughing. It's for meningococcal meningitis, it might even be kissing, sharing, eating utensils. So it's the respiratory droplets. You need to have close contact.
Yeah.
But they say that
so
washing.
What is close contact? I mean, could it be, if we're sitting in this room, for instance, somebody has early meningitis, is not sick yet, I suppose not picked up yet, and this person sneezes, can I catch meningitis?
It's not likely for some of the bacteria. For viral meningoencephalitis or meningitis, potentially, and interestingly, that is the one that is more self-limiting and doesn't require treatment. Even though it's a severe disease, it's the prognosis is not so bad. So to answer, those are the differences between some of these meningitis causes. Even in a bacterial meningitis, some of them are caused by foodborne contact. So Listeria meningitis, another bacterium, will not be from respiratory spread, but from what one might eat. So I think I'd like the listeners and Amy to understand that the different organisms are transmitted in different ways. Generally, yes, sneezing and coughing, we should be doing that into our shoulders, into our elbows, so that it doesn't spread, because there are other infections that could spread that way. And we should be washing our hands, and especially if one's sick, one should be careful not to spread what one coughs or secretions and saliva.
Okay. I want to come back to you about the outbreaks and the factors that promote transmission just now. But before that, Prof. Cooper, Amy mentioned the rash. How will you know that, this rash is chicken pox, it is not meningitis,
Well, I think firstly, it's important, and I think Anne mentioned it earlier, that there's only one of the bacterial causes of meningitis that may or may not be associated with a rash. Viral infections often present with what we call a non-specific rash, but the meningococcal rash is a very specific one. It starts off as what we call little pinpoint areas, which look like bleeding, and then it spreads very rapidly. So you'll see new ones developing, often sometimes even over minutes, but certainly over hours. And then as it advances, it starts to look more like a hemorrhage under the skin. And so that's a very rapidly advancing rash, developing, as I said, sometimes even over minutes, but certainly over hours. And if a parent were to see that, that's an absolute emergency to get to a hospital as soon as possible. But most of the rashes don't present like that. They may develop, a chickenpox rash develops over a couple of days, for example. So
perhaps the message then is, if in doubt, because I would imagine it's going to be difficult for a parent to know that this is the rash that I must worry about. Rather, take your child to a doctor.
If in doubt, get a professional opinion.
Yes. So look, they're showing on the insert the glass test, which is a test which you can do when you press against the skin, the rash, and it doesn't blanch. If it's a bleed, the blood and that rash will stay there. And in the UK and other countries, they've advocated for parents to use that sometimes. But I agree with you. Trust your instincts. If any doubt, go to a doctor or a nurse and have your child, whoever you're looking after, seen to.
All right. Let's talk about the impact. You may want to comment on these issues. You feel free to do so. But let's talk about the impact that meningitis can have, both on the sufferer and all around, the family concerned, the health systems in general, and so on. Prof. Govender?
Thanks, Ellis. I really think that we need to contrast adults and children again. The common causes of meningitis among adult patients is fungal or bacterial, sometimes viral, But the big differentiator is that the onset is much slower. So there's a subacute or chronic meningitis. And also, importantly, with fungal meningitis, there's no transmission from person to person. So if you're in the same room as someone with a fungal meningitis, that's not how you would get it. Everyone is exposed to this particular fungus, and it reactivates when your immune system is weak. In terms of impact, certainly cryptococcal meningitis causes numerous deaths. Up to a third of patients who are admitted to hospital will die, and thousands of deaths occur every year as a result of this type of meningitis.
Is it because of the difficulty to treat it? What are the factors?
It's a combination of difficulty with treating it. It often requires very long-term treatment, but also the fact that patients tend to present quite late. So when you have, when you've already lost consciousness and you've arrived at hospital, the chances of survival decrease dramatically as a result of the advanced disease that's already occurred.
Right. Earlier we spoke about, obviously we showed that clip on the outbreak of meningitis in Nigeria. And people watching this might wonder, what are the chances that, that outbreak will affect South Africa, for instance?
So that outbreak is in what is currently known as the meningitis belt in Africa, and it's got hyperendemic disease what that means is that there's high rates of disease, it's ongoing, and then they have their seasonal increases, and at the moment they're busy detecting their seasonal increase. In South Africa we also have meningococcal disease, and it's endemic, so it occurs in South Africa all the time as well. And our seasonal increase is coming in the next 2 or 3 months, where we will see an increase in meningococcal cases, and most, if not all of those, will be from endemic, from strains that currently circulate in South Africa. It's very unlikely that there will be any outbreaks or clusters of cases as a result of importation.
Okay. I believe we have another call on the line. Is it Judy or Dudu? Dudu from Devon. Dudu, welcome to Health Talk.
Hello.
Yes, your question or comment, please.
My question is about the same disease we're talking about. My grandson is 11 years, and he's started complaining about the headache every morning when he's starting to go to school. I can't calm him because he said it's paining, even outside the flesh in the scalp is paining. I don't know whether it's a meningitis, because I took him to the doctor, and the doctor just gave me a box of medicine, that's all.
Okay.
And I don't know what to do to know whether it's a disease.
All right. Thanks, Dudu, for your question. Let's get the experts to respond. Prof. Cooper?
Meningitis is a very rapidly developing disease. If this has been going on, and it sounded like it had been going on for at least perhaps a week or two, and perhaps longer, that's not meningitis. She'd have to look for another cause for the headaches.
So I suppose she needs to go back if the child is not getting better.
As I said earlier, it's associated with fever, and inability to look at bright lights and so on. So this doesn't sound at all like meningitis.
Yeah. All right. Just before we go on a break, quickly about the factors that promote transmission on a wider scale. Your comment on that.
So in fact, interestingly enough, the high disease rates in the African meningitis belt, they're not fully understood. And this is specifically for meningococcal meningitis and meningococcal disease. But it's thought that some of the dry air, the sand in that sub-Saharan belt might have something for promoting the invasion of these organisms that are normally found in the nasopharynx. I think in winter and the seasonal increases, some of it is the clustering of people, the closeness, and so that type of spread of respiratory secretions is just enhanced during the winter period. But it also differs in South Africa, where in the Western Cape it's slightly different because the climates are different. And then for the other causes of meningitis, the foodborne, it's going to be the exposure, and that might result in an outbreak where they're all eating the same cheese that had Listeria, or some other causes where the the viral meningoencephalitis, for example, is also seasonal, but sometimes more in the summer. And it's thought to be because there's a bit of another mode of spread of fecal oral. So interestingly, again, what could promote it will depend on the pathogen, on the organism, the the germ that is causing that meningitis.
But people would need to be close together for that to happen.
For most of, yes, for most of the causes, there would need to be some close contact, and it's not enough to be sitting and having someone sneeze in the distance. No.
Yeah, I suppose the important question to answer then is, knowing all what we know, what can we do to prevent? But that will take after the break. Now, after the break, we talk prevention. Please stay with us.
When cell phones get cut off, people say Mdluli was listening. Who are you?
We have to approach Dennis Breitenbach, who was the prosecutor by then.
The DA parliamentarian?
That's correct. The one who's making halabaloo about me.
There are allegations here that you abused the slush fund. What do you say to that?
We don't have slush fund. I don't know about slush fund.
I respect the fact that you cannot talk a lot about the Secret Service and all that. I guess that's the norm internationally.
Yeah.
But how do we know that you, Richard Mdluli, are not abusing the funds of the state? You are counted amongst the president's men. Are you?
That is rubbish.
Also the matter of General Boysen in KZN. He's not speaking very well of you.
No, that one is talking rubbish.
You are perceived to be very powerful, General, and you know, people who don't agree with you seem to pay the price. What is happening with the Oparamkhube case?
No, I'm surprised because as I've said, I'm a person of people.
Government Employees Pension Fund is set to acquire a 5% stake in Kenya's power producer KenGen.
The company says the sale of the 5% stake could have material effect on its shares trading on the Nairobi Securities Exchange. Last year, the company raised $264 million through a rights issue aimed at cutting its debt.
An alarm is growing in South Africa as the livelihood of millions of people who receive 17 million social grants still hangs in the balance. Right now, Net1's Cash Paymaster Services administers the payment of grants, but its contract with SASSA comes to an end in April. Neither the minister nor the SASSA CEO were present.
Welcome back. If you just joined us, we're talking meningitis, and we're going to be talking prevention and treatment of meningitis. And with me in our studio is three special guests. Prof. Nilesh Govender, closest to me, who's a clinical microbiologist from the NICD. And next to him is Prof. N. von Godbeck, who's also a clinical microbiologist, also from the NICD. And of course, Prof. Peter Cooper, retired academic and clinical head of the Department of Pediatrics and Child Health from Wits University. Now, I believe we have Simpiwe on the line from Cape Town. Simpiwe, welcome to Health Talk.
Yes, hello. Yes.
Your question, please.
My question, in fact, I don't, it's not a question, it's just that I don't know what I can say because I just saw that you were talking about the meningitis thing.
Yeah.
Yes, I have a boy. My boy is 4 years now.
Yeah.
When he was about 6 weeks, he got sick. Then we go to the hospital. When he got to the hospital, they say he's having feces. In that fit, they check him, and then they say he's got the meningitis. Then he started the treatment and these are things. But now he become paralyzed at that time because now he can't sit, he can't talk, he always lying down.
All right. Thanks for sharing that story with us, Simpiwe. Let's hear what our guests would say about that. Prof. That talks to the impact and the cost, I would imagine, of meningitis in the young, yeah?
Yeah, it's difficult to be sure just listening to that, but as I said, in very young infants, particularly those just in the newborn or just out of the newborn period, the signs are very non-specific, and so the treatment or the diagnosis may be significantly delayed, and meningitis can certainly lead to long-term neurological problems. But there may be other causes at work here. So I think what would be very important is that the child should be taken to a specialist or Red Cross hospital, properly evaluated to see if this was the result of meningitis or whether it was perhaps this is some other cause for the problems that she's now seeing.
Yeah. She mentioned fits. And is it common practice to have epilepsy soon after infection by meningitis?
Well, if it's caused brain damage, then certainly. It may be a presenting sign of acute meningitis.
Right.
But if it persists after that, after the treatment has been completed, then it's a sign usually of some brain damage.
Right.
So, Selo, you were talking, and we're trying to think about the impact of meningitis. In the insert, they discuss the meningitis belt, and about 5 to 10% of patients who have meningococcal disease and meningococcal meningitis may die. And in South Africa, the data that we have shows that it's very similar. And in fact, in the United States and the UK, for meningococcal disease, the rates of mortality, so death, are quite similar. And it's not because of anyone's fault. It's because we don't identify it soon enough, the doctors don't make the diagnosis, they don't get to treatment soon enough, and some of them are even at treatment and this organism will cause death. And it's one of the devastating sort of impacts of meningitis or meningococcal disease. And the other bacterial, so group B strep is common in the very young, and this might have been another bacterium that is common, an E. coli, for example, also. It's important to understand that these are severe diseases, they cause death, and if they don't cause death, there are other long-term sequelae, deafness, the epilepsy, the paralysis, and that's why we want people to think about this, to talk about it and learn about meningitis. So then, and as you were saying, so we can talk about prevention, we can talk about early presentation, and we can try and make those numbers as small as possible.
Sure. Well, following on that, now that, obviously we know what we know, let's talk prevention. We know what causes meningitis. How can we prevent young children, let's start there, being afflicted by this disease?
Well, the first thing is that the Department of Health in South Africa and elsewhere in the world, the ministries of health itself have recognized this as an important disease to prevent. And vaccines have been introduced into immunization, routine immunization programs that prevent different causes of meningitis. So I think the first thing to tell mothers and fathers and guardians is to remember to take their children to be vaccinated. And even in South Africa, we have some of the most expensive vaccines preventing, for example, pneumococcal meningitis. So that was introduced very soon after the vaccine had been developed, introduced in other countries. It was then introduced in South Africa. And these are massive amounts of money that are being spent by the Department of Health to make these vaccines available for free at clinics. So I think the first message to everyone is, if there are the vaccines available, go and get the routine vaccines that are available. And there's ongoing efforts to have newer vaccines brought into our routine immunization program, as well as there's research to try and prevent the other causes of meningitis using vaccines. So I think it's an ongoing dynamic field, and things will change in South Africa, but at the moment there's a very good array of vaccines that can prevent some of the causes.
All right, we're going to come back and talk about, travel, people that travel to those high risk areas, if we can call it that. But let's talk about adults now. We know that it's not transmittable, but in HIV infected people, what can we do to avoid people ending up with cryptococcal meningitis, TB meningitis, and so on?
I think we really need to make sure that doesn't happen, because the consequences are dire. If you develop meningitis, and if you don't die, the chances of neurological disability or poor neurological outcomes fairly high also. And these are people in the prime of their lives, people who support households. So it's really important to prevent, and the best way to prevent is to have people know their HIV status, start antiretroviral treatment as soon as possible, and the Department of Health obviously now provides antiretroviral treatment to everyone who is HIV infected. And if you are HIV infected and are on antiretroviral treatment, don't stop the treatment.
Right.
Because we're seeing that about half of patients with cryptomeningitis now develop meningitis because they've stopped their antiretroviral treatment. They've left healthcare services and they've developed meningitis again. The Department of Health has also set up a screening program for cryptococcal meningitis, where patients, the blood of patients is tested in the laboratory when they have poor immune systems or weak immune systems. And so that's another way to pick up cryptococcal meningitis earlier and prevent severe disease occurring.
All right. Let's take Big Boy. Big Boy from Bumalanga. Big Boy, welcome to Health Talk.
Yes, how are you?
Good, good. Your question, please?
Okay, sir. My doctor, she's rushed on there about more than 6 months. But we try to take her to the clinic, to the doctor, but nothing changes.
Okay, so your daughter has a rash and you've taken your daughter to a clinic, but nothing changes?
Also to that.
Okay, well, all right. Thanks for a question, Big Boy. Let's see if...
Did I hear correctly that was for 6 months?
Is it Big Boy is still on the line? No? Well,
it sounds
sometimes,
sounds like it's been going on for some time. Well,
right.
This is not meningitis.
Right. Okay.
Meningitis, as I said earlier, develops over 24, 48 hours.
Right.
So difficult to know what it is, but it's certainly one can rule out meningitis in this case.
Right. Okay. We spoke earlier about risk factors and high risk areas, if you like, and people travel. People go to Mecca, people go on holiday all over the world. What can they do before they travel to ensure that they don't pick up meningitis in these areas? Quickly, in 30 seconds.
So specifically, they need to worry about meningococcal meningitis, and there are the specific guidelines. So going into the African meningitis belt, if you are going to go into rural areas where you're going to be associated with lots of people, and you're going to stay there for enough time that your contact is going to be close to get the conjugate, one of the vaccines against meningococcal meningitis.
So you get that from a travel clinic? Yeah?
Yes.
All
and Hajj, they already recommend you cannot go on the Hajj to Mecca without getting the vaccine.
Right.
So there are clear recommendations. They're available on the in our guidelines. The CDC, other public health institutes also have guidelines, and so the viewers can have a look and see whether their travel would constitute a need for the vaccine.
All right. Okay. Time for another quick break. When we come back, we now talk about treatment for meningitis. Please stay with us.
From the moment you start your day. Good morning, everybody. It is 6 o'clock. We are there for you.
You want a guarantee from the leadership that we should not be leaders who will steal? I'm prepared to give that guarantee that we should not steal from our people.
We bring your morning into perspective.
This is the reason they keep putting fees up. They're not getting enough money.
We'll make sure that you get the full story. The police officers from specifically Moffat View Police Station, they support these brothels. What have you found upon your investigations on this matter?
I cannot deny those allegations.
And you can count on the weather team with expertise.
Join us live at 6 a.m. daily.
A conscious move from being a street kid to being a barrister of note.
Keep on praying for me to make a better life.
A creative application of the mind on an essential need, water in wheelbarrow containers.
How about if we were to come up with an idea of an enclosed container that sits on top of the frame of a wheelbarrow?
With the sharing of resources, a boy with Russell Silver syndrome receives medication.
The fact that you just said to me, well, you're covered for next month, that's amazing.
So that's the medication.
For more inspiring stories, stay tuned to Bupilong every Friday.
Welcome back. We're talking meningitis, now talking treatment of meningitis. And with me in the studio, Prof. Nilesh Govender, Prof. Anne van Godbeck, both of them clinical microbiologists from the NICD, and Prof. Peter Cooper, retired head of Department of Pediatrics and Child Health at Wits University. Now, before we start talking about treatment, let's go over some tweets that have just rolled in. Abe Kaur says, we're still battling meningitis. This should not be a new outbreak of Ebola. We do not have the resources. And Haroon El-Binawi says, with better living conditions for oppressed Nigerians, meningitis will not occur. Lack of good living condition caused meningitis and not God. CD says, as if I didn't have enough to worry about, now I've been told that there's been a bacterial meningitis outbreak. And Jack Levine says, every day of my residency, there was a child being treated for HIV meningitis, or the complications of Haemophilus influenza B meningitis. No more vaccines work. Interesting comments. Anyone would like to take any of them?
I can start with the last one. So the Hib vaccine is one of the vaccines, in fact, that is being used in South Africa. And that's exactly what is happening. There's been a massive reduction in Haemophilus influenzae serotype B meningitis, even here in South Africa. So we also tell these stories, and I think you can have that experience.
I can certainly confirm that, and I think the same applies to pneumococcal meningitis, which also, as Anne mentioned, has got a very effective vaccine. So the numbers of children we see with these specific types of meningitis has gone down dramatically in the last number of years since the vaccines were introduced. So again, it's a very strong plea to parents to get their children vaccinated.
Right. The other one referred to resources. This tweet, I would imagine the person is based in Nigeria. Treatment, resources for treatment, which is relevant to what we're going to be talking about. Do you want to comment on that?
So we're fortunate in South Africa in that we've got good resources in general for management of meningitis, and treatment is available at every level of the healthcare service, from primary healthcare through to district hospitals and academic hospitals. So, and there's generally are good referral systems. The important message is that meningitis needs to be treated at hospital level, and patients need to be referred very quickly to get hospital treatment.
Let's talk about what happens before that. You know, somebody sitting at home with a child that may or may not look sick. The importance of recognizing that the child is sick and getting the child to a healthcare provider. Any of you can comment?
Well, I think in general the clinics are the first port of call.
Right.
And the staff there are well trained to recognize what we call danger signs. And if they suspect a meningitis case, they will refer that child or even an adult immediately to the hospital. But knowing that there might be a delay in that child or adult getting to the hospital, they will usually give the first dose of antibiotic before the child or adult leaves the clinic. Because normally we only give antibiotics about every 8 to 12 hours. So that will allow the child or adult to get to the hospital, to have a proper diagnosis made, which, as I said earlier, is usually by lumbar puncture. And then the treatment can continue if the diagnosis is confirmed.
Why is it important to get the children for health care as soon as possible?
Because the more severe causes of meningitis, the acute bacterial meningitis, they are very sudden in their onset and they progress very rapidly. And the only chance of preventing death or some long-term outcomes is to treat them very quickly. And what we've learned over many years is that very first, giving that dose of antibiotic as soon as you suspect it. So even GPs it's recommended that if they see a case and they recognize it as being a bacterial meningitis, even they should try and give the first dose of antibiotic.
Does it matter what antibiotic they give?
Well, it depends on the pathogen to some extent, but there is one antibiotic that will cover most of the acute bacterial causes, the more severe ones, and those are the ones that are even available at our clinics. So they're part of the essential drug list in South Africa. The Department of Health have recognized the need to have this drug available in even small clinics, and they get the right antibiotic. And we monitor here at the National Institute for Communicable Diseases what resistance patterns these bugs have and what we should change to if in the future we need to change. So yes, it is important, but hopefully there's enough data and evidence over time that we give the right information to the Department of Health and they then have the right drugs available for treatment.
Okay, let's get back, stay with children for a while. How is meningitis treated? Is it only in hospital via a drip, or can they take oral medication?
No, it must be in hospital and it must be via a drip, because the doses have to be adequate in order to eradicate the bacteria that are causing it. And you can't get those sort of levels in the blood with oral antibiotics. So it's in hospital via a drip intravenously with other supportive care depending on what's needed.
All right. We'll get back to this supportive care now. Let's just find out about adults, the treatment principles of meningitis in adults.
So it really depends on the cause of meningitis.
Right.
Clearly, if it's bacterial meningitis, much like Peter's described, if it's TB meningitis, you need to confirm, and then in that case, the treatment is usually oral, sometimes via nasogastric tube if the patient is not conscious. But with cryptococcal meningitis, the fungal meningitis, you need treatment in hospital through a drip for at least 2 weeks, and then very long treatment after you leave hospital.
Okay. All right. Now, there's a question on Twitter. Sarishna says, please explain why there are no effective neonatal vaccines for certain serotypes of meningococcal meningitis. We're getting very interesting questions.
Absolutely.
Let's give it to you.
So meningococcal vaccines are not given in the neonatal period because it's not a classic cause of neonatal meningitis. It's given to slightly older children. But our view is completely right that the vaccines that are available don't cover all the serogroups of meningococcal meningitis or septicemia. And that's because of technical issues of the polysaccharide capsule, and that some of them work and some of them don't work. But there's lots of new vaccines that are coming onto the market that are available. Even in the United Kingdom, they're using a new serogroup B vaccine. So I think watch the space, and over time more and more of the serogroups will be covered, and hopefully there will be a universal meningococcal vaccine in the future that will be available to prevent all the serogroups of meningococcal disease.
All right. Let's get back to treatment now. You mentioned something about other supportive forms of treatment. Do you want to expand on that a bit?
The children, we would normally treat meningitis for at least 7 and usually 10 days. Sometimes even longer, particularly in the newborn period. But depending on their condition, they may or may not be able to, particularly in the early stages where their level of consciousness may be low, we have to make sure that their fluids are kept up with, so that the drip may provide, we may need to give the fluids that way. And temperature is often a problem, so we need to treat the temperature if it gets very high.
Okay.
Generally just to look after the child and make sure that they're going to come through this in the best condition as possible.
All right, well, then I'm going to give you each 15 seconds to sum up, yeah?
So I'd like to just emphasize again that there's the causes of bacterial and viral meningitis. Some of the vaccines prevent these, and that viral meningitis, for example, there aren't antivirals that we would use for treatment, and the only treatment would be supportive care, and that the course is often not as severe as it is for the bacterial meningitis.
Your turn.
Adult meningitis is more common than people think. People need to know their HIV status, start antiretroviral treatment, and stay on it in order to prevent meningitis. But also they need to know about the new screening program for the fungal meningitis.
Okay, well, Prof. Nilesh Govender, Prof. N. van Godbeck, Prof. Peter Cooper, thank you so much for your time. And folks, it's on that note we'll come to the end of our show today. Join us again next week, same time. And remember that our show is repeated on Saturday mornings on the news channel. Thank you so much for your questions. Thank you for your tweets. I'm Dr. Solomon Daung. Please take care.
failure to implement the water restriction is going to make the system not workable. For the domestic use, everyone should not exceed 25 kiloliters per day.
What is the penalty and how much have you raked in thus far as a municipality?
For domestic users, if they exceed 25 kiloliters, then they're going to be charged a penalty on their monthly bill. And so far already we've collected 1.7 million.
The 200 million rand state-of-the-art school in Magaliesburg had been vandalized by drug addicts. How bad is it?
It's very bad. Into the hostel residents, it was even worse because there the doors, the wardrobes, the beds, the ceiling were broken down. Showers were ripped off and it couldn't be used by students who are actually using that particular boarding facility.
Water-wise, water is an essential need. The scarcity of it could lead to loss of many lives, including livestock, plants, and much more. It requires us to use it sparingly and responsibly in times of need, failing which our taps and sanitation will not function. For more on water and weather issues, stay tuned to News Today, every Friday at 4:45 Central African Time. SABC News, making you water-wise.
A conscious move from being a street kid to being a barrister of note.
Keep on praying for me to make a better life.
A creative application of the mind on an essential need, water in wheelbarrow containers.
How about if we were to come up with an idea of an enclosed